to turn on your cameras if it is convenient. We know that many nurses joining us from the training halls. It will, if it is convenient for all, I request you to turn on your cameras. And I would also request you to please keep your microphones muted so that we can avoid the background disturbance. You may unmute yourself whenever you have a wish to ask a question or share your thoughts. Right. Thank you all for start turning on your cameras.
Good morning, ma'am.
Good
Right.
morning,
Clara ma'am,
everyone.
good morning.
Good morning.
So, on behalf of the INS India Hyderabad chapter, it is my pleasure to welcome you all to this insightful webinar on overview of INS Infusion Therapy Standards of Practice, 4th edition 2025. We are truly honored to have with us leaders who need no introduction, that is Colonel Binu Sharma ma'am and Dr. Jyoti Clara ma'am. Thank you ma'ams for joining us today. Before we begin, I would like to invite Dr. Vinci Ashok Tribhuvan ma'am, co-chair of INS Hyderabad chapter, to extend her greetings and share a few opening remarks. Over to you, ma'am.
Hi, everyone. A very good morning from Vinci. And thank you, Sai and Hyderabad chapter, INA chapter, for rest all whoever is part of our Hyderabad chapter for organizing this wonderful event. So from beginning, INS Hyderabad chapter has been very active. We all along with the Sino, we have got our calendar. So in the month of January, in the month of Jan, we celebrated IV Nurses Day very elaborately. Second month, we had around 50 nurses across Hyderabad chapter coming to Care Hospital. So we had, a lot of exciting discussions. We had elaborately, we spoke on INS infusion chapters, and most of the leaders were very into to understand how it is, and we had other following activities. Third month, we had knowledge sharing session by our Continent Hospital, and fourth, we were supposed to have, but as it is the financial year starting, appraisals, various other activities across most of all our nursing forum happening, this is just 2 days delayed. Anyhow, I thank Sairam. Thank you so much on your leave, making this happen and reminding me on time to be here. Thank you so much. And I thank all others who are there for attending this program. It will be, I'm sure, a lot of enrichment and lot of knowledge you would take away. Coming back to INS, fourth edition, it was released last year, and it is main intent is evidence-based practices, quality, safety, regulatory compliances, how we can abide by the clinical guidelines and all this. And what are we going to get from this? Improved patient outcomes, we can preserve lines for longer time, we will be abiding by regulated norms, so many. And above all, for me, everything is my patient goes home satisfied, having a high experience of infusion therapy. And whom are we going to hear it from today? None other than the nursing veterans, our very own Dr. Clara Madam and Binu Sharma Ma'am, who has led this INS from the beginning with such agility, resilience, and it has gone. Now, in the whole India, everyone wants to be part of INS. That's how she has brought this up. Now, without wasting much time, I'll hand over to the other eminent leaders, Binu Madam and Clara Madam. Let us go ahead. Thank you once again, everyone.
Thank you, Dr. Vinci. I think I can see Captain Madhukari Ray as well. Madhu, can you come on a video for the audience to say hello to them?
Good morning, ma'am. Good morning, Dr. Jyoti, Dr. Vinci, and everybody present here. Hi, Pooja.
Welcome, Captain Madhukari, our INS president. Welcome. I sorry I couldn't see you because I have logged in from mobile.
Yeah, I just
Yeah,
saw
yeah,
Madhu.
no
Madhu
issues,
always
no issues.
ensures that she joins all events.
Yeah.
Yeah. So I'm very happy to be part of it and really good to see that this chapter is doing such a good work and coming up with such a good session, which will be very, very important for everyone to understand, to know, and the eminent speakers that we are going to have Kanvi Binu and Dr. Jyoti. I'm sure that all of us will be enriched with the knowledge that they will be imparting. Thanks to you all and all the best.
Thank you. Thank you, Madhu.
Thank you, Vinci ma'am. Thank you, Madhukare ma'am, for the warm greetings and welcome. Now it's my privilege to invite our keynote speaker, Colonel Binu Sharma ma'am, CEO of INS India, to share insights on the INS journey and the new initiatives. Ma'am, over to you.
Thank you. Namaskar, everyone. A very great Saturday morning, rather just about afternoon. And I'm very happy to connect with all of you. And what we are talking today between myself and Dr. Clara are, one is letting you know what is Infusion Nursing Society. I'm sure you know something about it, but I want to put in a nutshell whatever initiatives INS has right now and is planning for the coming time, and what has been briefly the journey of INS. We wish to take you through that. Only that will inspire you, motivate you to be part of INS for those who are not already part of INS. And Dr. Clara will take you through the most recent standard of practice which are released last year. You should know that the standards come to us from Infusion Nursing Society, United States, as we are an affiliate chapter. These are reviewed, modified, and edited by the editorial board, which you will see in my presentation. We've got a very expert board. And she'll take you through all the sub-chapters and what deals with, so that you understand what the standard of practice bring to you for practicing nurses, practicing clinicians, doctors, pharmacists, and the nursing leadership and the quality team which is engaged in formatting the policies and procedures. With that, kindly allow me to share a brief presentation of mine. Now the presentation doesn't wish to move. Just allow me. Okay. Can you see the presentation in a PowerPoint? Yes.
Yes, ma'am.
All right. So I've written as journey and initiatives. You need to know what INS has done in last 15 years and what initiatives have been taken by INS. Okay. Why does INS matter? INS stands for Infusion Nursing Society. Many a times I see non-nursing professionals getting confused with INC and INS. Indian Nursing Council, you all must know that we are all RF registered by Indian Nursing Council, that's a governing body for nursing in the country. And Infusion Nursing Society is a not-for-profit society working in the field of infusion. Global leadership sets international standard for safe and effective infusion therapy, evidence-based guidelines, professional growth, patient safety, community and collaborations worldwide. It connects nurses, clinicians, researchers, and organizations worldwide. That is how we are part of the INSUS and we are affiliated to INSUS. INSUS is formed in 1973 in the US at Norwood, and 1980 was the first infusion standard of practice which got published. And we in India came into existence in 2010 when like-minded nursing leadership and some industry partners of healthcare came together to form a society which is Infusion Nursing Society. And from then, a 15 years journey has been very satisfying, very gratifying, at the same time, very, very challenging. You know, when a baby is born and when it is in the infancy state and in the pediatric state, it is highly vulnerable. There are a lot of challenges in making the infant grow up. So exactly same, we went through a journey which was highly challenging. We took time to let people know there is a nursing specialty like infusion specialty across the globe, and India also has to take it up. So I said the mission is we are setting the standard for infusion safety and excellence. We help develop and disseminate standards, professional development, knowledge-based, skill-based, and the values are that we are committed to excellence, integrity, inclusiveness, and above all, innovations. This is the national level officials. Myself, Captain Madhukari Ray, the president, and Captain Sandhya Shankar, the general secretary. We have a governing council and general council. If you see on my left is the governing council, which is myself, Captain Madhukari, Sandhya Shankar. We have a treasurer, Dr. Bala. We have Dr. Jyoti Clara as a very senior governing council member, Miss Saroja, Miss Claire, Miss Bindu, Josephine, Dolly, Rita, and Sainu. So we've got about 11 nursing leaders in the governing council. Governing council is the decision-making core body of Infusion Nursing Society. We also have a general council, which has a lot of even founder members. In that you read a lot of names. We've got names from across the country, south, north, east, and west. And in the general council, we also have people from the INS partners, which is 3M, BD, Polymed, and B Braun. So you find a couple of names there. Okay. Just allow me, this slide refuses to move. Okay. Let me exit and move it. Technical glitch. Okay. So taking you through, INS India has a lot of city chapters or state chapters. We call these India forums. Uh, we formed the society in December 2010, and the first chapter to be launched, Clara, that's for your ears, music, was Tamil Nadu in 2012, Delhi and NCR. 2013, we moved on to Karnataka and West Bengal. West Bengal is also a very mature chapter, so is Karnataka. 2014, we launched Kerala chapter. 2015 was Andhra chapter, which is hosting the webinar today. We moved on to Mumbai chapter, Pune chapter, Bhubaneswar, which is now Odisha chapter, Gujarat chapter, which started with Ahmedabad in 2019, the Goa chapter, Rajasthan chapter, Uttar Pradesh, Punjab, Nasik, Chhattisgarh, Madhya Pradesh, Uttarakhand, and very recent ones in 26. In January, we launched Uttarakhand chapter. And very recently, 2 weeks ago, we launched Noida, Greater Noida and Western UP. And we have just formulated the Haryana chapter. So you see, we have about 20 chapters across the country. We have to only move to few more states to be able to penetrate the hospitals as well as nursing schools and colleges across the country. So Infusion Nursing Society is not limited to just hospitals. We do a lot of events, knowledge-based, hands-on, skillathons with the colleges. We also have a membership for the students, which is called as INS Yuva. These are, I have listed down for everyone who's around. We have each city, we have a few chapter officials. The chapter officials are usually a chapter chair, a chapter co-chair, a scientific manager, a general secretary. So for each chapter, you will find that there are all of these positions are there. Wherever there is a governing council geographically present, we have listed that as well, or an editorial board member we have listed. This is for people to know in their state or in their city who are the INS officials. The job of the INS officials is to drive the activities. So, for example, Andhra Pradesh, which is hosting it today, we have got Dr. Vinci as co-chair, Ms. Sainu, governing council and chair, Ms. Ishita, scientific manager. Our very dear Madhi is also scientific manager, and Ms. Pramila is the general secretary. Likewise, these are other chapter officials: Rajasthan, Tamil Nadu, Uttarakhand, West Bengal, Punjab, Uttar Pradesh. People are highly interested now and wish to engage with Infusion Nursing Society India. That is the benefit of INS. These are Bhubaneswar, Delhi, Chhattisgarh, Madhya Pradesh, Noida, Greater Noida chapter officials. So, we have been blessed to have the patronship of many senior leaders. I have only put few names here. We've got Indian Nursing Council. Something has gone on my presentation. Let me. Okay. Dr. Dilip Kumar, the president in Indian Nursing Council, has been among our conferences many a times. Dr. Girdhar Gyani from HPI, Dr. Alex Thomas, Dr. Vijay Agarwal, the KAHU ex-president, now president emeritus, Dr. Atul Mohan Kochar, the CEO of NABH, people from 2CI, and many other such bodies have been giving their presence in our conferences. This is from inception to impact, starting with 2010 and moving on to 25 and 26. 2010, we formulated the society. 2012, we hosted our first conference in Bangalore, and it was a huge success. We had the presence of INS US President Ms. Nancy. Thereafter, we have not looked back. 2014, we got the first edition in India for the infusion therapy standard of practice. We have been moving up, and now in 2025, we got the fourth edition of Standard of Practice, and we have already held 13 annual conferences, and the 14th one will be happening this year. This is how the Standard of Practice look like, the latest one. These are the various chapters, and the editorial team is right in front of you. We have got Dr. Rita from West, Dr. Lata from North, Dr. Jyoti from South, Dr. Deepa again from West, and Ms. Dolly from East, who review the standards when it comes. I request all of you who have not had a chance to see these standards, acquire a copy. It's a very nominal amount. Please get a copy. Tell your chapter officials to get you the copies. And there are printed copies available. We can send you the copies. We have been doing Skillathons, which is a signature program of Infusion Nursing Society India. Our Skillathons are basically hands-on stations, whether we train you on peripheral IV cannulation, central line, midline, PICC line, chemoport, arterial lines, blood transfusion. We have been doing this since 2018 or 19. In fact, 2018, when we held our annual conference in Chennai, that was the first center under the leadership of Dr. Clara. We hosted that conference. It was a huge success. And that is where we held our first Skillathon. We have also been doing for last 4 years leadership challenge Skillathons. So we invite leadership from various hospitals. They come as a team and we do a complete 1-day pre-conference Skillathon. Again, a highly engaging session for the nursing leadership. So in 2014 at Hyderabad, we had all of these hospitals hosting it: Yashoda, hosted the leadership and all others hosted our various clinical skillathons. Some of these snapshots you can see here. In 2015, our annual conference, which was hosted at Pune, Lines of Care and Lifeline of Change, again was a very different flavor conference. Why do I say that? Because we had an agenda which was very unique and very exciting. We spent 2 hours on a live moot court with a doctor, a dummy patient, a dummy doctor, nurses, the patient's family. It was something which brought emotions, fear, and tears among the audience. We had about 2,000 people, 1,600 online, and about 650 plus offline attending the conference. We had a case study from the Mumbai Dabbawala famous group, which has done their case study even at Harvard. We had some very fantastic presence of armed forces leadership from Command Hospital and AFMC. We had not many competitions, and as usual, we had our Lifetime Achievement Award. So it was a different flavor conference. Every year we come up with new ideas, and every time we think we can still do better. So let's see what we do in the next conference. These are some of the pre-conference activities. So in 2025, we also added a new flavor, which is a walkathon and a marathon. So this idea came up from our Pune and Mumbai team, and we did a marathon with IT officials and police in Pune, and we did a walkathon at Juhu Beach along with Mr. Milind Soman's family. So the yellow t-shirts you see of Mumbai and the white ones at Pune, and we did all other activities which are skillathons, leadership challenge workshop at the Ruby Hall. So INS is not only working in the field of building knowledge, building skills, building leadership, but also encouraging people to come together, collaborate, and also work on your physical aspiration, which is in the form of a walkathon, marathon, bringing communities together. So that is what we do in the conferences. These are more activities of 2025. And this is the future conference, the 14th annual conference, which is happening in the month of November at Ahmedabad. Every drop matters. Elevated patient-centered infusion care. That is the theme. I urge the participants to please join this conference. We do a hybrid model. You can register once the registration gets open by next month. You can register yourself for your physical presence. You can participate in all the 7-8 type of competitions we do. Innovation, best paper, best QIP, elocution, posters, and lot many more things. And these posters, some of the competitions are also open to students and many are for nurses. And you can also register online. You can participate in the competition. You are most welcome. We look forward to see you at Ahmedabad, which is a beautiful city. And this is something we are looking forward to meeting more of you year on year. We have an electronic newsletter, and you see a lot of snapshots of the electronic newsletter. The newsletter is titled as iNews. Ms. Dolly Bishwas is the chair for newsletter, and we have got a newsletter committee. And I encourage all of you to send articles related to vascular access device management, infusion therapy, any QIPs you've done, any best practices you have, and please send it to the team to be reviewed and published in the iNews or our digital newsletter. We wish to see one newsletter from each chapter coming at least once in a quarter. That's not a very major ask. This is the biannual newsletter so far. This is the iNews committee you see here. and lot many activities. The designing and editing partner for us is Polymed under the leadership of Ms. Pooja Swaroop. Okay, INS has got a lot of partners, and we have got 3M as a platinum partner. We've got BD India as a platinum partner. We've got Polymed as an associate knowledge partner and BBRON as an associate knowledge partner. We also have got EBECMed for Healthcare Excellence Series, and we have got Vidyanta as a simulation partner, and we are aspiring for many more. Infuse is something I am very, very proud of. Infuse is a certification for infusion excellence. The hospitals can apply for it like you apply for NABH or nursing excellence. It's a quality improvement initiative hosted on the platform of INS with 3M as a partner. We have already enrolled 140 hospitals, thanks to all the nursing leaders who are very enthusiastic to enroll and get done the certification. We have certified close to 75, 80 hospitals. We already have got 60 plus registrations for the current financial year. And it's a very mature and well evolved QIP for us, a certification. So, sorry, the slide has come in between. This was Kolkata, which did the first enthusiastic walkathon under leadership of Ms. Dolly Bishwas. Okay, so Ivy Day was also celebrated across the country. Coming back to Infuse, we've got Infuse curriculum, which has got 9 modules, and the people you see on this slide are the people who have recorded the training content for each module. So this is, once you register for Infuse and apply for Infuse, we support you to get your teams trained. We support you to get ready. We hand over the training material to you. You can design the SOP manual, and there is a list of Infuse assessors who are trained and well oriented by Infusion Nursing Society. You see the names here, about 28, 30 names, which is increasing every year. They are the people who come and do your Infuse assessment. It could be 1 day or 2 days based on the size of the hospital. They give us the audit report, which is reviewed again, and then you get your Infuse certification. We also have, along with 3M, other than Infuse, advanced IV certification courses, and these are the SPOCs for the courses. These are available online. We have got Miss Irene Sundar for central line, Dr. Kotal for central vascular access device, Dr. Rita for arterial catheters, Miss Dolly for peripheral vascular. These are very well articulated programs on the website of the INA. These are online programs. We also have got INS and BD as a nationwide collaboration. BD India is also a platinum partner for INS. We do a whole lot of initiatives and activities with them. IV care through city level CMEs. We have done multiple last year. And we have BD and INS coming together. We conducted in Pune, Chandigarh, Chennai, and Bhubaneswar last year. We have a mastermind quiz where 25,000 nurses take part, and the final round happens on the INS annual conference with 5 finalist team coming, and it is a fantastic program where nurses are quizzed live in front of 2,000 audience. Very exciting for nurses. We have also started Inspire, another program of recognition and excellence across the country. We also do QIP competitions, which is judged by the INS jury, and the winners represent themselves at the final conference. So this is with INS and BD India. We also thought collaboration is the way to move forward. So we have come up with an event, Luminary Conclave. We started it last year, And we'll be continuing with that again this year. We held 4 last year, North, South, East, and West, where Infusion Nursing Society and Association of Operating Room Nurses come together to discuss best practices. That's a wonderful platform. Again, we do it with support of 3M India. Coming to our third partner, which is a knowledge associate partner, Polymed. We do a webinar every month, which is known as IV Talks. It's a very, very exciting webinar. We've been doing it since January 2025. So 15, 16 sessions, 300, 400 people every month joining it. It is usually a topic-based or a disease-based doctors, pharmacists, medical admin, nursing leadership, educators, infection control team, rehab team, nutrition team, again a collaborative approach where people come together to present a topic for 1.5 to 2 hours. And it is something which is again highly knowledge gaining webinar month on month, and we continue even this year on the platform of Polymed. Polymed also does for us, let's go back to basics, fundamental one-day workshop. Since 2019, we've done more than 100 workshops, about 3,000 people already certified. And we also have INS Icon Awards along with Polymed, various nursing leaderships for the exemplary work are awarded and recognized at the annual event. Our fourth partner is INS and BBRON together. We've been partners for more than 3-4 years. We do leadership summits with them to build leaders across the country, where we have emotional intelligence, a 3 hours workshop, and some best practices and tools discussed. We've done Asia Book of Records with some 30,000 odd nurses participating. INS and BBRON plan for 2026 is also very huge. So Nursing Summit is already planned, which will be with about 60 nursing leaders. Also coming up with a webinar series, which is known as VISTA, Vascular Infusion Safety and Therapy Advancements. And you see a lot of topics for QIPs all listed here. And another event with BBRON, they are starting a series of Lead Next program that is for the level of supervisor, charge nurses, ICNs, and educators. 5 such programs are planned for this year, starting with Bangalore, Kochi, Mumbai, Pune, and Delhi. So there's so much exciting stuff happening on the platform of INS, which I don't see any other association or society really engage so heavily with nurses, right from student level to practicing nurses to specialized nurses to team leaders, head nurses, educators, quality nurses, infection control nurses, nurse managers, and the nursing leadership. End to end building our capacity, building competencies, and building skills. INS has also launched last year a program, Infusion Nurse Certification course. It's a 6 weeks program. It's a hybrid model. Some part is a contact program and some part is online. It is open to all registered nurses. Here, simulation partner is Vidyanta. Program will be done by INS leadership team, and it's a 6 weeks hybrid model. We wish to see many people applying for it. We also have another partner, which is EPEC Med. Thanks to Dr. Clara, who introduced us to EPEC Med 2-3 years ago, rather about 2.5 years ago at Hyderabad, where we signed the MOU. We do excellence series with them, hands-on series. And this is the signing picture. These excellence series have been done in last 2 years. Again, we have a plan going ahead this year on excellence series, which are highly appreciated by the nursing team. These are usually done in different cities. These are various INS online certificate courses which are available on the website for you to take on. Coming towards the end of the presentation, I showed you and took you through the journey. Please mute audience, please mute.
అదే అట్లనే పర్లేదు నాకు
Okay. So why join INS India? You heard about all the initiatives we have been taking. Can you, somebody mute everyone, please? Mute the audience.
Yes, ma'am.
Ma'am, you can unmute yourself. Binu ma'am, you can unmute yourself once.
Ma'am, please unmute yourself.
Okay.
Yes, ma'am. We can hear.
Okay,
Yes,
why
yes.
join INS
Okay,
India? You've seen all the initiatives, the CNAs we do, the webinars we do, the hands-on, the leadership program, the quality-related programs, conferences, networking opportunities. So please, I urge you to come forward and be part of the Infusion Nursing Society India. The lifetime membership is just about 1,500 rupees. We also have for students INSUA, so college people who are there, please promote it. And the website is right here. It can be shared again in all the groups. And these are the benefits of being a member. And infusion nurse is not just administering therapy, they are infusing safety, precision, with compassion in every drop. As we say, every drop matters. And I thank all of you for listening to me. I think I have taken a lot of time, and let me just stop sharing. I think I've stopped sharing my presentation, or you
Yes,
are
ma'am.
still seeing it.
Yes,
Yes,
Okay.
ma'am.
So this is about the INS journey. I've taken good amount of time and left 35 minutes for Dr. Clara. Exactly, that's what she wanted.
Yes, ma'am. Thank you, ma'am, for the insightful session and for taking us through the how Infusion as a society has evolved in India from its beginning to the present day. We truly appreciate your efforts in highlighting the many initiatives by INS to improve practice, strengthen standards, and support our nurses. It was an informative and inspiring session. Uh, Thank you all the participants as well. It was wonderful to see more than 150 participants joining us during this busy day. So we now move to the core session of the webinar. For that, I would like to invite Dr. Jyoti Clara, ma'am, founder, the Health Breach, and the GC member of INS India, to present an overview of the infusion therapy standards of practice, the latest edition, that is fourth edition, released in 2025. Over to you, ma'am.
Thank you, Sai. Uh, 1 minute, just a minute. I will share my slide. People are joining up.
There is hello.
Can you give me the okay?
There is humming.
Yes. Are you able to see my slide? I can put it in slide
Yes,
mode.
ma'am. Yes, ma'am.
Okay.
Yes.
I'll just put this in slide mode so that is it in slide mode?
Not yet,
For me
ma'am.
to start?
Not yet, ma'am. Not yet.
Yes.
Yes, ma'am.
Let me start my presentation with a word of thanks to INS. Because INS means a lot to me, as other associations like ANI, CAHO, and HPI, which has actually helped me to grow even after so many years of experience. Every interaction, every meeting, every conference, every assignment that I take in with INS is a beautiful learning journey. So I would like to thank, and especially my good friend Binu, Colonel Binu, for being inclusive in considering all of us so that we all can join hands to take INS forward. The today's session is specifically on standards of practice, and I'm going to give you an overview. When this topic was given to me just few days ago, maybe 3-4 days ago, I was just wondering how am I going to present the entire 287 pages as a preview and as an overview to all of you. But then it was interesting because we all took part in the review. It was easy for me to at least consolidate and make it a meaningful presentation, I hope, for all of you. So when we see the INS standard, it is basically around infusion therapy, and it has got 66 standards, 287 pages, and 3 new standards added to it. Now, the presentation will complete with 7 basic aspects. And we will start with about ANS, the standard, key factors and facts and figures, structure all 66 standards, and new edition, 9th and 4th edition, and key challenges of updates and clinical implication and summary and question and answer. Now, why it is important? The importance of INS standards. I know Bino has given a wonderful preview about what INS stands for, and it stands tall for clinical practice. And clinical practice, the one single aspect, every hospital, every institution, make it as a mandate is the painless relationship with patient. And when we say pain, it is always with IV and it is always with the infusion. And the nursing knowledge and nursing competency around us is very important. So the importance of INS standard is one is standardization of patient safety so that we assure it, support the accreditation readiness, empowerment of nursing staff, quality improvement, and governance. So these are the 4 major pillars that is giving us as an importance of INS standards. Now, there are new evidences and practices priority that is given to the current standard. So what are they? Shorten the revision cycle. Excuse me. I expect participants to be conscious because there are good listeners, those who are participating here, they want to listen because these are little heavy subject. People have to understand clearly. Thank you so much. Shortened revision cycle. So 5 years to 3 years of revision, integration of new researchers, new practice areas, and expansion of home infusion therapy. So these are critical points that we have to remember. And in the future, if any of you want to be part of INS revision or any other aspects of the standard practice, then you must know these 4 critical points. Now, INS India standards. So what is it all about? Like we have founded with HQ New Delhi, headquarters is in New Delhi. I think Binu has given the briefing of all these. I need not again go into it. But at the same time, I want to say that publications are invited. There are publications happening, and wherever there is opportunity for us, like connecting with NAPH or with INC, we relate and we promote INS. And INS US 9th edition is very significant because that is our roots. So from the roots, we have taken our standards, which is customized to India and the Indian user end. And revision cycle is another area like you have to know. And when we said that 17 to July 23, this is again well explained by Bill. Now remember these numbers, very important key factors and figures. We have 66, 287 and 3. And here we say the revision cycle is 3 years and the 9th edition of International INS Standard is the 4th edition for us in India. And it has got 2,500 plus source reviewed and the peer revision cycle. Every per revision cycle. Now, what are some of the evidence methodology and structures that we can see in INS standards? We have level 1, level 2, level 3, level 4, level 5, and AP and CC, the standard structures, and we have all these incorporated into the standards. So it has literature cover from Cochrane to Medline to PubMed to Science Direct to Scopus, CINAHL, which is a nursing-based database, and MBAS is another one. And all these, I'm not going to read all of these, but all of these were the literature base, and it is not coming from the mind or heart of any of us, but it is coming from the evidence and the literature. So the methodology and the structure is very clear, and people can follow this. Professionals can adopt it. And excuse me. And people can adopt it. Now, when we see this, we can see that this particular standard is not specific to nursing. This particular slide talks about how all other professionals who were involved in infusion, anesthesiologists, MBBS doctors, and all the professionals in healthcare, those who are involved in infusion practice, maybe the EMR technicians, those who are emergency trauma care technicians, all of them can embrace these standards because this is going to usher ultimately safety for patients. So this particular slide gives an endorsement, a very strong endorsement, saying that it is a 7-star document which can be adopted not only by the nurses, but else or all other professionals in healthcare. The framework, all 66 standards are divided into these areas, and you could see like 1 to 13 standard basically explains about practice foundation. So foundation of practice, which covers patient care, special population, scope of practice, infusion and vascular access, competency, QI, evidence-based, patient education, and informed consent documentation, and adverse event, and all these product and the drug divisions as well. Now, this next part comes to 14 to 20, which expects the user end to follow safety and infection prevention. 21 to 32 is vascular access devices. Device management is 33 to 42, and complication prevention, like possible complication, actual complication, and what are some of the things that will. This particular standards, like 43 to 52, defines, like brings nursing definition to bedside. Diagnosis and treatment of human responses, both actual and potential. And this 43 to 52 is critical. And this is linked to business in hospitals. This is linked to spend of the patient. This is linked to waste management and lean concept. And this should be our focus, and more researchers around this, QIP around this are significant. Now, we can also see there is a specialized therapies from 53 to 66, like epidural, intrathecal, intraosseous, and so many others. And we will be, if you go into the standards, it's just fascinating, like how somebody could bring in such an elaborate and an inclusive book for reference for the professionals. Now, standard 13, what are the new edition? We are going to see, I'm going to touch upon only new edition because most of you are familiar with the older edition. The new edition, what is included is in standard 13, the drug division in infusion therapy. So the key standard statement here includes the aspects, like there are 4 aspects in this: organization that procures, dispenses, handles, and or administers controlled substances, and establishes policy, procedures, and protocol, and processes for proper management through the medication pathways. So medication pathway is another call for this particular standard. The next one deals about an organizational culture of safety is fostered to promote prompt reporting and confidential, non-punitive integration of suspected patients. So this is again a very critical part, and most of our SOPs do not engulf this, and probably it's a call for us. Now, healthcare team members with access to the controlled substances are trained and competent in role-specific processes. Each CS administration is accompanied by a valid order that an authorized prescriber is giving. So these will actually help us in giving few recommendations as a practice. So the recommendations are given here. These recommendations are very critical because unless we follow this, we will not be able to meet the standard to the extent which it is prepared for. Now, implementation, where it talks about the program that we have to have in the nursing service and in the hospital, establish surveillance using automated dispensing cabinet or medication safety and or the system, use secure chain of custody throughout medication pathway. This is basically for misuse or pilferages, and consider lock transport devices from pharmacy to unit, conduct FEMA to identify vulnerability, not only vulnerability, variability as well, foster non-punitive reporting culture, cross-team collaboration, pharmacy, nursing, law enforcement, and risk management. Law enforcement is very critical because it is a legal entity and we need to know about it. And if your policy does not have, please incorporate, identify, and get to know who's the law representative in your hospital. And why this is added. Drug division is a patient safety and occupational hazard requiring explicit infusion safe specific guidelines. So this is the reason this has been incorporated. What is the next new addition? This is 65, vasopressor administration. So this again has got 3 specific standards, and these 3 standards helps us to give us few practical recommendation. Here, the key definition that is given for vasopressor therapy is medication that promote vasoconstriction with potential positive entropic activity. Example are given here for you, where you can also consider that these 3 standards are very much critical, and it needs lot of understanding of the nurses and the other practitioners right from their induction if they are going to have. And if you want to give them the privilege of administration, your privileging for medication administration can have this as one of the sub competencies, and privilege should be specific to this. Now, these 3 standards, select most appropriate VAD, which is again the one that you're selecting, which is efficient and which is minimizing complication. Validate VAD patency prior to initiation and during vasopressor, and reassess VAD plan. Now, this resulted in recommendation, which is like initiate in a patient VAD, like you have to see that the balance, risk and benefit are assessed. Basically, decision making for nurses, peripheral or central. How do we decide? What is the decision point? What are the decision priorities? What is the final decision, and how are we going to validate the decision once the decision is made? So, balance fluid resuscitation and vasopressor based on tissue perfusion goals, and the other 2, which is more like very practical, where you go for reducing extravasation, and we also go for a preventing complication, right? Now, in this, there is one point that I have not put in the slide, but it calls to the attention. This is much critical for ICUs. In ICU, many times we say patient suddenly deteriorated. No patient will suddenly deteriorate. This standards calls us to understand that there will not be, unless we focus. Hypertension, and all these are related to fluid management and vasopressor management, and we need to understand why this particular this particular standard is incorporated. This is an evidence gap exists in VAD selection in time critical vasopressor delivery, and now it is explicitly addressed in this particular standard. The third one is the standard 66, which is the most need of the hour. When we say need of the hour, this is across the globe. It's just not in India. People are moving, the aging population is increasing. India is considered to be the youngest population country. But now that is how the transplants have taken a toll. And some years it will be that way. But very soon we will also be like any other country where the aging population is going to be the number is going to increase. This is basically because we are preventing complication. We are attending to growing aging population in a different way where we are able to preserve their health, improve their well-being, and their longevity is expanded. And with this reason, like it is important, and also the cost in hospitals are getting higher. And hospitals are not ready to give their bed as a rental bed to patients. They wanted to discharge patients early. So home care is going to be, when I say home care, it is just not home care. This also talks about the standardized institutional care, like geriatric centers or the homes that are being specially built, which is not the hospital. Yeah. So they can adopt this, but these standard, and it specifies three important aspects, like home infusion is provided with attention to appropriate patient selection and collaboration with patient, caregivers, and interprofessional team. So here the collaboration is caregivers are given more specification because they are the decision-making point. So they need support from patient, from the relatives, and the interprofessional teams. The relatives are on call. The relatives are in video. They are in WhatsApp. They are in WhatsApp. They are in FaceTime. So they may not be there next to the patient. So it is care providers who are going to be next to the patient. So risk of infusion related complication, appropriateness to access devices, and the method safety of the patient, clinicians are evaluated before accepting the patient. Now, the third one is home care organizations provide a comprehensive program including clinicians, education, evidence-based policy, QI program, and infection surveillance. Now, in this, there are few categories that have been followed. One is the antimicrobial stewardship, which is a stronger one, which is extended beyond the hospital compound or boundaries, hydration solutions, parenteral nutrition, anti-neoplastics, analgesics, biologics. Yeah, and we also have the other drugs. Now, the next one is related to key update in infection prevention. And here, when you talk about infection prevention, the standard 17, standard 47, standard 31, they highly emphasize and they marry each other, which is very important. See, when you look into the standard, you don't see standard as a standard alone, but you see it widely. When you see it widely, you understand that there is a relationship between different standards. One complements the other. One supplements the other. But more than supplementation, complementation is seen much, in my opinion, across the standards. Now, antiseptic non-touch technique and related infection prevention stats. So these two are highly emphasized. And the third one is site antiseptics and dressing. It calls my attention to also share something that we have done in Kaho. We did a wound care prep, like patient experience is being measured when a wound is being cared. 17 hospitals, 1,500 plus, close to 2,000 patients participated. Care providers were there. And this has been published in the reputed journal with a high impact factor. And this has been also presented by me in one of the international conference. So that talks about like how patients are to get involved. Probably that can also be incorporated into this in the coming revision. And this is already implicitly there. So we could use those tools probably in our hospitals as well. In vascular access devices, here again, the standards 21, 26, and the standard 28, it covers the aspect related to vascular visualization, CVAD, tip confirmation, and VAD planning, site selection, and flushing and locking. Why I am not going into each of this is, this is a start of the series. We have experts coming in to speak about each of the standards in 9 different presentations. I wish all of you don't miss even one, because every single presentation gives us elaboration of each of that what I have giving as an overview. Now, complication and patient safety covered in 3 different standards, 43 to 52, 44 and 50. Now, this again covers aspect related to phlebitis, infiltration and extravasation, because there is always a confusion between these two, and nerve injury, catheter associated thrombosis, catheter associated skin injury, and this is a new one that has been added, and embolism. Now, the next specialized therapy is like we have standard 58 to 62, 23 and 61. This covers aspect related to antineoplastics, biologic therapies, parenteral nutrition, flow control devices, blood administration, intraosseous access. Now, coming to clinical implication for practice. What are some of the clinical implications these standards are giving us? One is VAD planning is now a strategic decision. Vasopressors protocol, know your VAD option. Home infusion, structured patient selection. Aseptic technique, ANTT is a standard. Drug diversion, here a shared responsibility is there, which we need to understand. And skin injury and securement, here the prevention is first. So I've just given you a tips where clinical implication is put in just 1 or 2 words, but you will be seeing this more in the subsequent 9 different presentation by expert. Now, quality improvement and infection prevention and documentation is one significant aspect. We may have several accreditations, several certification programs. We have ANI. So when the ANI was brought in, like Association of Nurse Executive India, certain documents, we had reference of INS included in that. And in the NABH Nursing Excellence, me being one of the author of that, I've also suggested, with permission of Colonel Bino, incorporated this as a reference material. So any assessors, if you are assessors in NABH or Nursing Excellence, please see that you make sure the hospitals own one document of this. And we also must make sure that the hospitals are adopting this. And this is basically to start with nurses, and we can expand to other professionals. Now, 3 aspects are significant under quality. One is quality improvement methodology, which again talks about FEMA, Lean Six Sigma, and various other things that will identify and mitigate infusion related risk proactively so that patient doesn't enter into complication. Infection prevention standard, there are new aspects coming in. This is basically on the devices, but also we bring in an approach of patient interaction, patient involvement. Enhanced documentation practices, documentation emphasizes electronic health record, standardized template, and a smart pump data integration. So these are the things. So this is beyond hospitals. It also suggests, so these standards also are suggested to various companies, agencies, and device producing entities where they can also adopt and use these standards for their studies. INS standard mapped to NABH, very important because all of us hospitals are going for NABH in some form. So it is important. Where are they mapped to? Infection control alignment, human resource standards, patient rights and education, medication and patient care. Of course, in COP it is there, but basically in these are the areas there is a connection. One slide summary for hospital leaders, because without hospital leaders' support, we'll not be able to take any practices forward. Unless the CEO checks off or sign off, we'll not be able to make, or if they don't give, or if the philosophy or the standard practice of the hospital says that money is more important than quality, then we cannot do anything. So we need to engulf or involve the leaders where the leader support is like a backup. So whether they are practically involved or not, they have to be pulled into, they have to be told, sharpen your ears, turn on your listening ears. Dr. So-and-so, Sir so-and-so, Madam so-and-so, turn on your listening ears. INS is one of the beautiful standards that your hospital should have. And nursing heads should believe. Some nursing heads still not yet believing, but you have to believe that these standards are critical. Just not as a certificate on the wall, but in reality, it goes right, translated to patient care. So standardized infusion practice is the one that they have to understand, reduces variation. And once the variation is reduced, the risk is reduced, the potential for maybe adverse event is also less. That reduces cost on the organization and it improves business as. It's a business strategy. Supporting accreditation, yes. Any hospital going for NABH JCI, before you could go for it, we suggest you go for nursing excellence. And second thing, you should go for INS standards because it makes your life easy and it makes your NCs lesser. And when I mean NCs lesser, it doesn't mean the number of NCs are lesser. No, it reflects that your quality is good. You can also project that the nursing is extraordinary in that particular institution. Leadership impact. Key leadership benefits include reducing adverse event, improving audit readiness, and enhanced nursing confidence. So once these three are there, to the leader, the business also develops. Culture of safety and compliance, implementation of INS standards fosters safety culture, regulatory compliance, and sustainable quality improvement hospital-wide. So this must be whispered into the ears of the hospital leaders, the CEOs, the owners of the hospital, the universities, and so on. Now, this is a bird's eye view of what is the changes that has happened at the international level from 8th to 9th edition summary. Those are incorporated into our 4th edition as well. If you want to click a picture, you can click, or this particular slide will be shared with INS. It will be available in the website so you can have a view of it. Summary and key takeaways for us for today. 1. The INS Standard 4th edition 2025 adopts 9th edition INS US standards, the most comprehensive revision in the specialty's history, with 66 standards and thousands of evidence sources. 3 newly entered standards, emerging clinical priorities, drug diversion, vasopressor administration, home infusion. We should not forget these points, very important take-home messages. ANTT is now the globally adopted aseptic technique framework. Every infusion professionals must be trained and certified and competency assessed in both standards and surgical ANTT. Ultrasound guidance has moved from encouraged to recommended standards of practice. So we should know the difference between the word encouraged to recommended standards of care for difficult vascular access and CVAD insertion and arterial line placement. VAC planning is a clinical and ethical decision. Vessel preservation, least invasive appropriate device, DIVA assessment, the team-based decision making are now mandated in the practice. Team-based decision. Who's in the team? The vascular nurse is in the team, or the nurse who is certified to do this is in the team. Catheter associated skin injuries is now in a much more emphasized. And here the skin assessment and evidence-based securement strategies. Why we included this? Because the evidences keep changing. Everything is dynamic. Today, what is the best practice may not be best practice tomorrow. This is not an ultimate standard. In 3 years down line, we may have the next edition coming, which will again talk about what is then practical, what is then evidence, what is then the doable thing based on research and evidences report, right? And the sources. Now, with this, I would like to congratulate and thank all the members, those who have internationally and nationally contributed towards this. And me being part of it, I don't take it as a pride, but I take it as a accountability. And thank you, Colonel Binu, for the opportunity. And it was wonderful working with all of the team members in leading the revision for India and consolidating and sharing with all of you. Discussions and decisions, like we have to have the discussion now if there is a time. Never forget 66 standards, comprehensive infusion therapy framework, 3 new standards, drug, diversion, vasopressor, home infusion, 3-year cycle, continuous evidence-based updation. So this is very critical for all of us, and we need to follow the 9th edition of International Infusion Standards, which is customized as 4th edition 2025 by INS India for practice and implementation. So I finally thank Colonel Bino, the CEO, all the national officials. Captain Madhukari is here, Captain Sandhya, I'm not sure, but thanks to all of them. And thanks to INS Telangana chapter official, Saino, thank you. You touched base with me. And thanks, Dr. Vinci, for rendering this support. And special thanks to Mr. Sriram for organizing the webinar and staying in touch to make this day logistically perfect for all of us. A big thanks to each of you participants for being here. This is my credential, and if you'd like to connect to learn anything, you can do. But however, INS has got an office and INS has got connections, and you have got a state officials who would support you. And of all, you have the national officials to be with you. I thank all the EC members also. And some of you EC members have joined. Thank you for joining, and wish you a wonderful evening. And thank you, all of you.
Thank you, Clara, for a wonderful insights and orientation to the INS standard of practice. And we are just almost on time. Thank you, Saino, for coming on a video, coming to the platform. And if audience has any questions, we will just stay on for about 5 more minutes. Any question, put it in the chat box, please, or you can unmute and speak up.
So we will now open the forum for any questions or clarifications from the speakers. Please feel free to share your thoughts as well, if any.
Hi, Dolly, you are also there.
I want to say Madhukari here, and I want to say that this is the session which was really informative and very, very learning session. And I feel that I'm not still like it is provoking me to think a lot, to take it forward to a different section so that it becomes very fruitful. So I wish that once again we repeat this session for all the chapter officials so that everybody comes to know. And Saino, thanks to you for, getting this
Planning it.
idea of, getting this idea of actually doing this fantastic idea. And it is very informative. Thanks, Jyoti, for having it. And ma'am, always this is your brain. So very, very nice session. It was really
Thank
good.
you, because we thought that the chapter edition, the standard of practice are new edition, and people still have not bought the book. People have still
Exactly.
not read through it, and also initiated. There are a lot many things people do not know. People sometimes confuse INS with 3M, INS with BD, INS with Polymed, INS with B-Bron. INS is Infuse, Infuse is INS. INS is INC, INC is INS. So we thought we will take them through
No,
one
but it was so crisp and informative, very crisp and informative. It
1
cannot be
hour
shorter
and we
than
are
this.
done. Just 1 hour. Yeah.
Yes, very nice.
I really would
So
thank the
thank you.
official ma'am here. When the AOP came, we thought about having inculcating inculcate all the chapters of infusion standards. So that was our aim for the month of April. And somehow it did not work out. Then Sai said, let's do definitely a virtual session on the overview. And then the resource person fell as, and then we had her to come and speak. Nothing good like that. It's like the icing on the cake which we had. We are having her to speak on this, and then you taking it up. And I'm really very obliged to all the governing council who has taken their valuable time during this day, and the second of the month, and all of you have given. So this is so important. That's what it reflects from all of your time here. It's so important, and everybody on this platform. Many of us may not be into any official positions as nurses in their respective places, but we can make a lot of difference if we work with certain standard protocols. So it's for all of us here to take it up. I'm really obliged and thankful to all of them. And Sai, thank you for putting this. And this is not going to be ending. We're going to have the chapters discussed in the consecutive
Now we
month
should
after May.
do chapter
We will do all
wise
the
one webinar going through the year.
Yeah, and
So
we will open
to
it to all the
complete the cycle with one
Okay.
webinar for each chapter to
Yeah.
be discussed in details, the various SOPs, the salient features.
Yeah,
And
exactly.
I think let us do that as a repository, because there are a lot of new
Yes, ma'am.
chapters.
Actually, I
do
was
not-
thinking that only. We
Yeah.
will make a portal where we'll be having a depository of all these, SOPs, standard related
yeah.
SOPs that have to be mentioned so that it becomes a ready record for all
It
members.
becomes easy
Yeah.
for all the members to refer to it when
To
they
refer
are
to.
going on the
Yes.
website.
Yes.
We will do
yes,
that.
Yes.
Thank you, Clara, for doing a wonderful session.
Wonderful. Yeah.
And Pooja has already recorded this as well. This can go on our website. Both the presentations can also go on the website.
Yes, ma'am.
Thank you,
Yeah.
audience.
Actually,
I think 30
we
people have
to
already
wish all
gone
of
up.
them a happy Nurses Month. This is a
Yes,
Nurses
we
Month.
are.
And that gives me more excitement. And INS has opened up to connect all nurses. I think we are the first one to connect all of them, right?
On
As in
9th May, Clara, we are doing a communication webinar, which is to improve communication between patients and nurses. We are doing it with Ms. Nadira, who is with the Patient Safety Foundation. So we are just getting the flyer ready. So we wish to see 400, 500 people in that webinar. These are all for International Nurses Day. The initiatives from INS.
Interesting.
So
Great.
Thank you.
thank you once again, Jyoti ma'am, for such a comprehensive and insightful session. So understanding these standards in a short webinar is not easy, as said by Madhukari ma'am as well. But you made it very simple to grasp the intent and the overall overview. So I am sure it has added immense value to all of us. And to conclude today's webinar, I would like to invite Ms. Ishita, Scientific Manager of INS, to deliver the closing remarks. And thank you, Saino ma'am, taking time out of your busy official commitment to join us. So I request.
Birthday, Ishita.
Hello,
Yes,
Ishita.
thank you. Yes, ma'am. Good afternoon, all. It was lovely listening to all your conversation, and really, it was such. It is. I would say it is kiss keep it short and sweet. It was very nice. I think even my team members all are there. I have around 150 nurses gathered here. They are also listening
Wow.
in the CNE. So I take this opportunity on behalf of Telangana INS to extend my gratitude to both the stalwarts, Colonel Vinu Sharma and Dr. Clara, for taking immense, interest in guiding all of us on giving the valuable insight on the infusion therapy standards of practice. Your contribution today, ma'am, have not only enhanced the knowledge to all the participants, but it is an inspiration to all of us to strengthen our commitment to quality care. And being nurses, I think infusion is the core heart, because IV cannulation, infusion, whenever we think, it is the nurses that come in the mind. So thank you so much. And as we conclude today's program, let us carry forward all the key learnings from today and translate them into our daily practice to ensure safer outcome for our patient. Special thanks to our audience and Saino ma'am, Sai, you have been really immense help. Sai Ram, you have been following up with all of us, and also Vinci ma'am. Thank you so
And
much.
thank you,
Signing off.
Pooja, for hosting it on Teams.
Yes,
and for
Pooja.
being
Yes,
our host.
Pooja is always a call away from all of us. She's always such a sweet person to help us.
Thank you,
Thank you.
everybody.
Thank you.
Thank you, audience. Have a
Ma'am, Dolly
great
this
weekend.
side. Good afternoon, Dr. Clara, Colonel Binu, ma'am. I was just hoping that I could have joined a little early to listen to the entire webinar, but I stuck up in a meeting. I could not join, but I can imagine with your talk that it was a wonderful session. So anyway, you are going to upload in website. So I will also share all my nurses that the presentation details. And thank you of having such a wonderful session. Thank you.
You can do it for all
Thank you,
your
Dolly.
chapters.
Yes.
You can take a lead. We will share both
Yes, ma'am.
presentations. You can
Yes.
use both the presentations. Yeah.
Absolutely, absolutely, ma'am.
Khushbu will do that. The INS manager will share it. Whoever
Sure.
wants it when they intend to do. Okay.
Yeah. All right,
Thank
ma'am.
you.
Thank you very
Thank you,
much.
Dolly
Thank
ma'am,
you
for
so
joining
much.
us and for the remarks. And I
Thank
also
you so
thank
much.
Ishta ma'am for the closing remarks. Before we leave from the webinar, I would like to request all participants, if it is convenient, you can turn on your cameras so that we'll take few
Any other
screenshots
chapter
of,
officials
Take
or
a picture.
ECs there?
Yeah.
we'll
Take a
take
picture.
few screenshots of the webinar.
Come on a
Thank you
video,
all for
whoever
turning
is
on
there.
cameras.
Yeah.
You all can continue smiling. I'll be taking a few more screenshots.
Okay, Sai.
Yes, thank you all.
All
Thank
right.
you.
Thank you, everyone.
Bye.
Thank
Thank
you,
you.
everyone. Happy
Bye.
Nurses
Bye.
Month. Happy Nurses Month. Yeah.
Happy nurses.
Happy
Month.
Nurses Day to
Nurses
everyone.
Month. Yeah.